And there are other hinks kinks in the system. And part of that is, and I want to reiterate here that I would have loved to have seen a public option. We have some measure of a public option in the form of the Affordable Care Act, at least in about 25 states, providing the seed money for co-ops, which are nonprofit insurance companies. The federal government has provided seed loans because, of course, it's very hard to start this up. You need to have a certain amount of capital to begin with, which will perform the same function. These, the extension of these co-op financing was, I think, basically ripped out in the fiscal cliff deal. So, like I say, only exists in about 26 states. The best we can hope from the Affordable Care Act is that it's going to provide models in some states that are going to create pressures nationally. That is going to take a while. One thing that we were told throughout this process was that the Affordable Care Act is a work in progress, not unlike Medicare was, not unlike Social Security was, not unlike S-CHIP was. The law is passed. It becomes clear what is problematic with it. It becomes refined and honed and fixed in some respects. We know that in Vermont, we're going to see, in all likelihood, a single-payer program that hopefully will be a model and create pressure on other states to adopt such a plan. The problem with the theory of it getting fixed as problems come up, as different interested parties say, hey, we have a problem with this, we have a problem with that. Now, the data as to whether or not, and because the Affordable Care Act says that if you have full-time employees who are getting 30 hours or more, they constitute a full-time employee. You got to give them health insurance. If you have if you have a company that has more than 50 employees, you got to give them health insurance. There have been different data sets and studies that have shown whether or not there are companies that are, or a significant number of companies that are starting to roll back some of their employees, just giving them 29 hours a month to avoid that. There is some anecdotal evidence that some companies are hiring only 49 people. I've seen studies that have contradicted that. We don't know, really, until probably a year into this thing, what's actually going to happen. However, there were hopes in the drafting of this bill, apparently, that some of those things, particularly those 2 points, would be fixed. But, of course, we're now seeing the Republicans are refusing to tweak the bill on a national level because they still are beholden to these 75, 85% of Republicans who want it repealed. The rest of the country does not want it repealed. To the extent that there, as I mentioned in that poll, people are against Obamacare, only 35% want it repealed. 16% of those of the 51% who are against Obamacare want it to go further. So we have problems with the law. One of those glaring problems is that 9.5% of your household income that would make you eligible for the exchange. What is clear now is that there needs to be a statutory fix that computes that household income. It is the share of the income for an individual, but it does not take into consideration that you may also have a family of 4. In which case, it becomes much more problematic. Because it basically only calculates the individual's cost of health insurance as opposed to what it would cost to get a family. Michael, you're looking at me like I'm not explaining this well. Oh, you do get it. All right. Well, you need to work on your
I'm looking at it like
on your
that's
visual
a significant
cues.
problem. That's a significant problem. I'm giving you that's a
It
concern,
is a
Mark.
glitch that needs to be fixed. It will not be fixed. And there's some question as to whether or not Health and Human Services could change that, or the IRS, whoever's in charge of that regulation. As reported in the Times, the way that this law was drafted, the idea that a provision that takes back some of the subsidies if your income rises in the course of a year would have been softened. Democrats were debating the 50-employee definition for large businesses and were open to additional flexibility for seasonal workers and teenage employees. Some companies hire 55 employees during Christmas time, let's say, and then cut back to 35 for the rest of the year. These were all notions that would be fixed after the law passed because they didn't have the ability to massage these things following the special election of Scott Brown to the Senate in January 2010. So the implementation of this is going to be rough. It's going to be even rougher in those states that have opted out of the Medicaid expansion, which was, in many respects, the centerpiece of this legislation. It was going to provide some 30 million people with health insurance. We now have a situation where if you make over 130% of poverty, between 130% and 400%, you are eligible for federal subsidies in these exchanges. If you make less than that, and you live in a state that has not increased Medicaid to 133% of poverty, you are SOL. You will get no health care coverage. We're talking about Texas and Florida, Kansas, Alabama, Louisiana, Mississippi, Georgia, all refusing to expand Medicaid to 133% of poverty. Even though for the first 5 years, 3 years, it would cost them nothing. After that, it would cost them 10% of those costs. People in those states who have incomes from poverty level up to 4 times that amount, $11,490 to $45,960 a year for an individual, can get federal tax credits to subsidize the purchase of their health insurance. Like I say, the rest, SOL. The CBO estimates 25 million people will gain insurance under the new health care law. Researchers at the Urban Institute estimate that nearly 6 million uninsured adults with incomes below the poverty level could also gain coverage, except that they live in states that are not expanding Medicaid. Here's just some quotes from advocates who work in those states. B. Moorhead, Executive Director of Texas Impact. A lot of people will come in, file applications, and find they're not eligible for help because they are too poor. We have to tell them, if only you had a little more money, you could get insurance subsidies, but because you're so poor, you can't get anything. That's an odd message, a very strange message, and if people are sick, they'll be really upset. In Atlanta, the Director of Outreach and Advocacy at Georgians for a Healthy Future, quote, hundreds of thousands of people with incomes below poverty level would be eligible for Medicaid if the state decided to move forward with the expansion. As things now stand, they'll not be eligible for anything. What do we tell them? The Executive Director of the Louisiana Primary Care Association. If the breadwinner in a family of 4 works full-time at a job that pays $14 an hour and the family has no other income, he or she will be eligible for insurance subsidies. But if they make $10 an hour, they will not be eligible for anything.